Hi, this is Lynn. Today I want to talk about successfully managing chronic illness. This is a short guide for seniors. An unfortunate part of getting older is that most of us experience an increase in illness, and many of us develop some sort of chronic illness, such as diabetes or heart disease. Regardless of the specific condition, several strategies can help seniors effectively manage chronic illnesses. Ideally, these strategies combine the efforts of individuals, their families, and healthcare providers, and should also involve close friends and caregivers. One place to start is to work closely with healthcare providers to develop a tailored care plan. This plan should encompass medication management, lifestyle adjustments, and regular checkups, taking into account your overall health, preferences, and existing conditions. Seniors often take multiple medications, making careful management crucial. Maintain an up-to-date list of all prescriptions, over-the-counter drugs, and supplements. In some cases, this may also mean monitoring foods, particularly for possible interactions and allergies. Use pill organizers or reminder apps to ensure medications are taken correctly. Regularly review medications with doctors and pharmacists to prevent interactions and side effects. Make sure prescriptions are refilled and that doctors renew prescriptions promptly when refills run out. Nutrition is key for maintaining health and supporting activity. Focus on a diet rich in vegetables, whole grains, fruits, and lean proteins. Eliminate processed foods, added sugars, unhealthy fats, and excessive sodium. If at all possible, eat organic as much as you can. This can help reduce pesticides and chemicals. Note that the European Union regulates pesticides and chemicals in food much more closely than the United States. So foods imported from the EU may be healthier than their U.S. counterparts. Most U.S. foods are laden with pesticides, which are neurotoxins. That means they attack nerve and brain cells. Check out the Clean 15 and Dirty Dozen lists on the Environmental Working Group website to discover the best and worst foods for pesticides. Exercise daily. Even moderate exercise can make a big difference. A 2022 study in the Journal of the American Medical Association suggests that even 10 minutes of moderate intensity physical activity per day can significantly reduce mortality rate for those over 40 years of age. Consult with a healthcare provider or physical therapist to create a safe and effective exercise program. Low-impact activities like walking, swimming, cycling, yoga, and Tai Chi are often recommended to improve mobility, manage symptoms, and boost mental well-being. Create a support system. Fashion a network of supporters and friends to form a network of people that can rely on each other for emotional well-being, a circle of good friends. Blue zones are places around the world where people live much longer than those in the United States, often reaching the age of 100 at rates 10 times higher than in the U.S. A key element of what environment creates a blue zone area seems to be in the networks of friends found in these zones. Enlist the help of family, friends, and caregivers to create your own blue zone. A sense of community often adds to quality and length of life. Practice relaxation techniques such as deep breathing, meditation, or yoga to reduce stress and anxiety and increase a positive outlook. Regularly monitor key health indicators like blood pressure, blood sugar levels, and weight. Keeping a health journal can help track symptoms, medication intake, and activity levels, providing valuable information for healthcare providers. Home monitoring devices may be helpful as well. Educating yourself about your conditions empowers you to take an active role in your care. Attend self-management education programs, stay informed about new treatments, and don't hesitate to ask questions. Managing chronic illnesses in seniors requires a proactive, holistic approach that includes lifestyle changes, medical management and support, and involves individuals, their families, and healthcare providers. These tips, combined with utilizing available resources, can help seniors navigate the challenges of chronic conditions more effectively, maintain their independence, and significantly improve their overall quality of life. Your focus should always be on a holistic approach that addresses not just the physical symptoms, but also the emotional, social, and practical aspects of living with chronic illness. If you found these tips to be helpful for you, please let us know in the comments, and please help us in turn by subscribing to our channel, liking this video, and just as importantly, tell others about our channel. You'll find some links in the description below. Thanks so much, and have a fantastic day.